Welcome to another enlightening episode of Culture Collision. I'm Victoria.
And I'm EJ. Today we're diving into a topic that's increasingly relevant in today's world, egg freezing. This medical procedure offers individuals the opportunity to preserve their fertility and take control of their reproductive future. We'll explore the science behind egg freezing, the reasons why more people are considering it, and the emotional and financial aspects involved. Join us as we discuss how egg freezing can empower individuals to make choices that align with their life plans and aspirations.
So the reason we want to talk about this topic is I just finished one cycle of egg freezing, and I want to share with my friends here and listeners here about my experience as introduce this to more women. So because after my close friends know I've done this procedure, and people ask me how does it feel, how much it cost, why you want to do this, right? So in order to answer your questions, so we want to explain a little bit more about what exactly is egg freezing and how does the process work from a medical standpoint. To be honest, for me, I didn't do much homework before, like only maybe 1 month before I decided to do this procedure, but I've been thinking this for a while. For egg freezing is a way for women to preserve their fertility for the future. So here's how it works, right? First, you take hormone injections to help the ovaries produce multiple eggs. And once the eggs are ready, they are collected through a minor procedure. These eggs are then frozen using a special method to keep them safe. They can stay frozen for many years until you're ready to use them. When the time comes, the eggs can be thawed, fertilized with sperm, and then implanted into the uterus through IVF. So that's the whole process. For me, I only do the first half is the egg freezing, the injections and the eggs when they are mature and extract the eggs and froze them.
Hmm. So, what are some of the main reasons individuals would choose to have their eggs frozen?
So I think for me, for example, is you don't know or you're not sure when you're going to have a baby or not. If you haven't decided I don't know if I like a child or not, and I don't have a stable life or I want to enjoy myself, enjoy my life better, then or some people want to focus on their careers or personal goals, right, before starting a family. Others might be facing medical treatments. So like chemotherapy, right? They could not affect their fertility. So, or sometimes it's just like not having found the right partner yet, but wanting to have options for kids for later, right? So I think it's a way to keep the future family planning flexible and also give ourselves an option. So I know a lot of people when they're in their early 30s or late 20s, they don't like children and they're not sure if they want child or not. Maybe they were so sure about I don't like any child in the future, but when they're in their early 40s or maybe late 40s, early 50s, and then they regret so this procedure or this thing is to give you an option. So in the future, if you want to if you have regrets or you're thinking, oh, actually I do feel like I want a baby, then there's a still chance you can do this.
Are there any common misconceptions about who should consider egg freezing?
Yeah, actually, I think some people think it's only for women in their late 30s or early 40s. Is actually the recommended is before age of 35. Because when you do this early, your eggs, the quality of your eggs is better, right? Like you can produce more eggs, as you can freeze more eggs, and you can suffer less. So I remember, actually it's very interesting. So when we went to the US, the summer program, and there's a student we met. She was 24 or something like when I met her. And she said, I want to do egg freezing because I want to be a lawyer. So in order to be a good lawyer, probably the law school, right? Like the test law school and the practice, it'll take about 10 years. No, she was like 22. She was so young, and so she realized I need to focus on career and I need to do the egg freezing. So if you have decided this is the right my career path is for the 10 years is set for me, then it's early. I think it's also good for you to do like in early or late 20s or like early 30s. Um, I think there also like the misconception that egg freezing guarantees a future pregnancy, but is actually everything is just like percentage. So maybe like freezing 10x, there you have 70% of the eggs are able to use, and then 65% of the eggs are actually able to produce a baby. So it's important to understand it increases the chances, but doesn't guarantee any success.
Hmm. That's something that I didn't actually realize previously. I mean, I knew that in IVF you end up losing multiple of like the viable eggs just throughout the process, which is why you can't just like freeze one, right? But I didn't realize like how those numbers decline and all the different like age factors and things like that. Um,
Yeah,
that's
you
really
mentioned about
interesting.
one, right? Like my friend asked me, I remember it's so funny. So I told them like I freeze how many eggs. They were like, "Oh, you can have how like this many babies." Like, no, that's not true. It's not that easy.
Yeah.
Yeah.
So, can you walk us through the typical timeline and steps involved in the egg freezing process?
Sure. So I'll give everybody a simple rundown of the typical timeline and steps involved in the egg freezing process, right? So first, I did the cycle in Australia, Melbourne. So when I was in Singapore, I found a clinic, I called the doctor. So my first call is with an online consultation. You can do online, you can do offline, right? You'll meet a specialist to discuss the health situation, reasons for freezing eggs, and the process. List down all the questions you have. So I remember I used like my phone, I list down like 10 or like 15 or 18 questions about anything I have question about this. And the doctor answered all my questions during their first consultation call. Then I flew to Melbourne. I met him again in person. So make sure, I think this is very important as well. So even though you talk to the specialist on phone, you want to meet him or her and to like see the vibe, how's the conversation, do you even like him or not, right? So I met him another time. That was like very short time. So like he gave me just like a rough basic treatment plan because before that you have to do some blood test. You have to do some ultrasound. You have to yeah, I think that's just it. So ultrasound and blood test to make sure like you don't have HIV, you don't have hepatitis B and C or other like disease, and check your hormone level. So that's the thing you need to do before like you start the procedure. And he told me a rough amount of the money, how much it could cost. So he told me because I don't have Medicare, which is the health insurance in Australia, so it's all gonna cover by myself. The total amount is around by 11,000 to 13,000 Australian dollar. So I have a rough idea and know how much money I should like exchange. And then after the test, right, is start with the ovarian stimulation, is the injection part. So it would take about 10 to 14 days. You take hormone injections to stimulate the ovaries to produce multiple eggs. And during this period, we'll do ultrasounds. So some I what like I searched that when I searched this online, I know some people do in the other clinic, other countries in the US or in like Thailand or other countries, they will also do the blood test. But I didn't do any blood test. I just do two more ultrasound to monitor the ovary, like how many eggs you have and are they mature or not. Depends like when after that they will change the medication plan where like you need more medication or you just like it's okay, it's ready, the X is ready to retrieve. And then when the eggs are ready, are mature and ready, right? They'll give a trigger shot. So I will take a final injection to mature the eggs for retrieval. In about 36 hours after the trigger shot, the eggs are collected from the ovaries in a minor surgical procedure under sedation. This take about 20 to 30 minutes. So it's very important because this is my first time doing like surgery under anesthesia. So I didn't know actually you cannot leave by yourself after you do the procedure. I know you cannot drive, but I don't know, like if I just call Uber, that's also not allowed. So like doctor, the nurse called me the day before, like make sure you have someone to pick you up, and we need to have their number to call them like you are here to pick up someone. And then basically for me, the process are done because the freezing part is by the lab and by the doctors. So the retrieved eggs are immediately frozen using a medical called vitrification and stored for future use. So overall, the whole process from start to finish takes about like 2 to 3 weeks, depends on like how fast your ovary is ready to produce the eggs.
Wow. That's pretty involved, you know? I mean, it's a pretty involved process. It sounds like there are a lot of steps. I'm curious, given how long that process is, what kind of preparation or aftercare is required for someone undergoing this procedure?
So that's one of the questions I asked the doctor during the first consultation call. So it's very interesting because I think from Western perspective and from Chinese or like Eastern perspective, the doctor give you different suggestions. So actually my doctor tell told me like you don't have to prepare anything. Just don't drink too much. If you don't smoke, that's fine. That's good, right? And exercise, just eat whatever you want, right? So I heard where like when I do the research online, some of the doctors in China, right, they'll see this as a pre-pregnancy, right? So they will give you like they'll ask you to eat nutritions, they'll like sleep early, rest well, like you eat all different kinds of like fruit, like vegetables, right? But for Westerners, like there's like act normal, you just do what you do. But if you do drinking, maybe just one glass of drink is fine. And caffeine, that's the same for like having pregnant, just 1 cup of coffee per day. Don't drink too much coffee. And that's it. But I think one thing is the preparation need to be prepared, like something you need to prepare is mentally. Because I like I mentioned the injections, right? Like for 10 to 14 days, you need to do the injections. So basically you need to take the shot by yourself. So someone is like, if you are afraid of needle and like faint, we see the needle, you're faint, which is a problem, right? Then you should have, or either have someone to do that for you, or second is just like maybe do some training or talk to people. The nurse actually will give you video and training on how to do the injections. But still, like people feel is like very terrifying. That's one thing I didn't realize. So the aftercare is normally won't do too much things after that. There is a one thing called OHSS. So which is if you produce so many eggs in one cycle, so many is above 18 or 20, so the ovary may get like overreacted. Then is a chance to have fluid in your abdomen. That's kind of a little bit like dangerous, but people will tell you, like the nurses will tell you before the procedure, see if you have encountered this situation, what you should do and how you should prevent it. Yeah, but like it's nothing like too serious. You'll like still be under control. Yeah.
Wow. I didn't realize it was one shot every day for 2 weeks.
Sometimes
I
it's
thought
more
it
than
was
one
one
shot.
shot and then you wait 10 to 14 days for it to activate.
So it's one shot every single day. And I think the day of, so it is very interesting idea is like so when actually the shots taking was beginning at the during the period. So the full day of period is like full blood of the period is day one, and start to do this shot on day three. And from day three to day eight, around that, like 5 days, just one shot, right? From day eight, you're gonna do 2 shots. So the first shot is hormone, right? To help the eggs to produce, to mature, to grow. The second shot is to make sure the eggs won't fall. And you're gonna have to do the 2 shots together for another about like 5 to 6 days, and then do the trigger. before the procedure.
Mm. So you've touched on a little bit about the financial considerations that people have to consider in some of the prep. I'm wondering, what are some of the emotional and psychological considerations that someone should keep in mind when deciding to freeze their eggs?
I think the fertility center they do a good job because I joined one-on-one session with nurse. So you can ask any questions you have. And they have also a webinar, a psychology webinar, to walk you through the process again and to make sure they answer all the questions you may have. Like I mentioned before, for psychology perspective, right? You just need to be prepared. Even the cycle, not mention about after you have the egg frozen and you having baby, the cycle itself, it could fail, depends on different reasons, right? And also like the fear of doing the injection, doing the shots, and the some people say like because you're injection hormones, right? So some people like the emotions were like riding a roller coaster. But for me, actually, it's fine, and I feel pretty happy all the time. So just be prepared for that. If you are already an emotional person, right, then you will encounter maybe like more different kind of like feelings during the process. Then you need to know how to deal with it. That's what like very important, I think.
Mm. So what sort of access to support systems or counseling services did you have during this process?
They gave me the number of the facility center and the nurse, right? So if you have any questions, you can call them. So for me, because I don't encounter any like emotional like episode or any like psychological support, so basically I don't need to make any phone calls. But I did two mistakes during the process. I called them like to make sure like I'm doing the right thing. So the the injection pen is quite tricky. It's very similar like those ones like the for the diabetes patient, the injection is like the pen looks very similar. So it's very tricky is sometimes you inject it in your belly and you need to press all the way down to make sure all the medicine are in the body. But like I miss some dose and then I call the nurse. So normally they answer your call, like they give answers to you very quickly. Of course, I get panicked because I inject the wrong like lesser amount of medication, right? One thing is I think most people didn't make this mistake, but I did. So it's the trigger. So the trigger pen is a different pen than hormone pen. So hormone pen I did for like 10 days, right? Around 10 days. And then trigger is another pen. So when I did the trigger, you need to have to do it on time because the procedure is scheduled on the exact 36 hours after. So I did on time, but the problem is like when you try to do the injections, sometimes like the medicine have some air, right? You need to make the air out. But that medicine, you actually don't need to do that. But I watched the instructions, the in in the pen together with the pen, and I tried to do that. Then I miss. So the dose I was supposed to inject is 250 ml, but I did inject around just 150. So I called the nurse the other day, and then they called me to the clinic and do another injection. And but just right before the procedure, the doctor was checking on me, right? And he said, Victoria, what were you thinking? This is the most important injection for the whole process. You know we may fail. I was like so panicked
Oh my
for
God.
the procedure. Yeah. I was like, because like I spent all the money, basically spent all the money already, right? So just like if this success or not, it's just like one day. So I want to like emphasize how important this injection is. Because the one before, the hormone before, I also inject like less, right? The doctor said like it's fine. It's just like you just no go back to normal, that's fine. So like one bit less, one bit more is totally fine. So that's not a big problem. But the trigger is the most important injection during the whole cycle.
Wow. I'm like, still processing. I mean, I'm glad it worked out. I mean, in the end, but what a scary thought to go into the procedure knowing that like it might not work out.
Yeah, I was like, I think my face changed, my body language changed, and nurse like she's getting me to escort me to the operation room. She's like, "Are you okay?" I was like, "I'm still in shock, but I'm okay. I
Wow,
guess I don't have time." Yeah.
that's amazing. Wow, wow, wow. Okay, so you do the procedure, you go through, 10 days of shots, you do the trigger, and they're able to retrieve your eggs. How long can frozen eggs be stored, and what factors can influence the viability of those eggs over time?
Mm, in general, the frozen egg can be stored for many years, sometimes between 10 to 20 years or more without significant loss of viability. But I was told by the facility center about like 8 years. I think because like thinking of my age and all the things consideration is like, so they told me it's 8 years. I think the main factor that influence the viability over time include the age of women at the time of freezing, right? And the quality of the eggs when they were frozen. So generally, like younger eggs tend to be healthier and more viable for future use, right? That's like also what we said in the beginning is like the misconception. It's not to do it in late 30 or like early 40s. So I would suggest like early 30s, maybe even late 20s. So make sure your eggs are healthy and they can be stored for longer.
Yeah, I have started hearing that like there are some companies here that are even like paying for their employees to get their eggs frozen because they know they're going to be really busy. Like if they work like consulting jobs or they work, or they get to a certain level, they know they're going to be working really busy, which I guess in one sense it's kind of like depending on who you are, that could be like an exciting thing to be like, oh my goodness, thank you. Like I have this option. But I think from the other side of it, it could be scary knowing that like, wow, I'm gonna be really locked into this job, like the example of the person that you gave earlier. So um yeah, it's interesting. It's something that I didn't I knew it was an option before. It's nothing that I didn't hear as much about. So it's interesting now younger people are going into the workforce with that option.
I think one more thing is during this whole process, but before you are doing this, right? If you have a partner, I think it was a conversation with your partner. Yeah, because I was talking to like a nurse from Taiwan before. She explained the whole procedure to me. And she, as a nurse, she observed a lot of couples doing the procedure, even like the married or not, right? So what she recommended actually, if you have a partner or husband or like boyfriend, so have them to do the injection. They are feeling more participate. They're also in this process, and that's just observing you are doing this, right? They can go to the hospital together with you. So if they're in the process, is kind of like important to them to let them to know like your girlfriend, your wife is going under this procedure. And this procedure, I won't say like it's a lot of suffer, but still like doing some injections is kind of a bit suffer. And the process, the procedure itself is after procedure is like is quite like a bit painful. So be involved and have some people like have the good conversation, be involved. And that also like it mentally will support people who are going under this cycle.
So let's continue in the process in that. Let's say we're, fast forward to the future and you are ready to start a family. What is that process for using the frozen eggs?
Yeah, so I did a little bit research on that, right? I think one word, IVF, is quite popular. So when someone's ready to use the frozen eggs, the process is to involves thawing the eggs, first fertilizing them with sperm in a lab to create embryos, and then transferring the embryos into the uterus. This procedure is called vitro fertilization, which is IVF. And the goal is to have them implant and develop into a healthy pregnancy. So that's basically how it works after like you're going to use your eggs and how you embed this into the uterus.
And we've touched on this a little bit, but can you go into a bit more detail about what are some of the potential risks or side effects associated with egg freezing, and how can individuals mitigate these risks?
I think this is very important because to be honest, when I did research, I didn't realize those risks or side effects might happen, right? But when I do the consultation and the nurse session and the webinar, I realized, oh, there are several things you need to consider. But I will say like I'll explain those, but I don't want people to overthinking too much because I didn't encounter any of those, right? So the first is what I just mentioned is OHSS. So it's called ovarian hyperstimulation syndrome. So this can occur after ovaries overreact to fertility drugs, leading to swollen, painful ovaries. Like I mentioned, like if you extract more than 18 or 20 eggs in one cycle, that is highly unlikely to happen. But even below 18, that's highly unlikely to happen. So you just like be aware of this syndrome. And the way to deal with this is to drink plenty of water and to eat high protein food. And if the pain delivers unbearable, you can even barely walk, just go to the emergency room. So the doctor or the nurses in the emergency room will take care of you. So that's the most serious one, right? The first one. The second is the egg retrieval complications. Because it's still a procedure, like it's a surgery, small surgery you need to do. And sometimes will cause bleeding, infection, damage to surrounding organs. So this part is that's why you need to choose a reputable and experienced fertility clinic and a specialist can minimize the risk. That's also like part of the reason why I do this in why I did this in Melbourne. And the third one is emotional and psychological stress. I didn't encounter any stress during the process. I was feel like pretty good, but this can varies with like your mood, with like how you produce the eggs, how you're like helping the eggs to develop. So seeking support from counselors or support groups can be beneficial. Also talk to the nurses because they always be very like supportive to me and to call them, right? And no guarantee of pregnancy. That's something you need to realize. It's not like freezing eggs means you are definitely gonna have a baby. It's just an option for you to maybe you change your mind if you want a kid in 10 years, right? Then you have an option, you can try, at least you tried. But if it doesn't really work, then just let it be. There's nothing else you can do. So overall, it's just like working closely with a healthcare team, following their recommendations and having a support system can help with like mitigate these risks.
Yeah, I think it's so important what you said about choosing a reputable and experienced fertility clinic. I think especially because you, I don't know if it's specifically for this procedure, but you definitely hear about it for other procedures that people get, that they will travel to, cut corners to reduce the price. Because, like, if you're paying out of pocket for these expenses, you want to find the cheapest place to do it. But sometimes the cheapest place isn't the safest place to do it, and you end up increasing your risk of having more complications. So, to all of those that are considering this or any other procedure, make sure you do your research and find someone who will do it right and keep you safe.
Yeah, so like I did this in Melbourne, Australia, right? I know when I do the research online, there are people doing in Malaysia, in Thailand. Hong Kong is available, Taiwan is also like you can do this, and also in the US. So Singapore also is like it's okay to do the procedure. It's very interesting. The reason I choose Melbourne, Australia, is one very important factor is actually when you use your ex, you don't have to have a legal husband. For the rest of the place I mentioned, I don't know, I'm not sure about Malaysia and Thailand, but for Singapore, Hong Kong, and Taiwan, you actually cannot use it until you have a husband, right? And the second is I compare the price. The US is the most expensive one, and then Hong Kong. And I'm not sure about Thailand and Malaysia because I don't really think I can go to these places to do this whole procedure. And Taiwan is quite kind of like relative cheap. Melbourne is kind of like in the middle. So the whole process for me, it took me, and the overall cost is about 9,500. So a little bit less than the doctor predicted. Yeah, depends on how many medication I was on, right? Like medication can vary from like maybe 3,000 to 6,000. So, and also feel like, but when I choose this fertility center, I didn't do too much work. I just like search, maybe there were like couple like two or three, and I search on like some online internet. I see like people's feedback, and then I did this because I think this fertility center has too many years, and this isn't one myth about egg freezing is I think for China, because we're not allowed to do this if you're not married. So like the people who did this is very small. The amount is very small. And they think this procedure is too big. It's very serious. I think it's not. It's pretty safe and well developed in the Western countries. So like either in the US or like in Melbourne is very like I think they're well like trustworthy. And also important thing is you need to make sure you can communicate well with the doctor. Yeah. Sometimes like Melbourne, they have doctors can speak Chinese. Make sure you choose the right doctor because some like medical terms you may not understand what does mean, right? You need to be fully aware of everything before you take before you choose to do this.
Yeah, it's super important. I am curious if we zoom out for a moment. How do you think the egg freezing fits into the broader conversation about reproductive rights and women's health empowerment?
I think egg freezing plays a crucial role in the broader conversation about reproductive rights and women health empowerment, providing women with greater control over their fertility and reproductive choices. Like I mentioned, this is an option for you. So by offering the option, right, you can do whatever you do want to do now. You can pursue educational or career goals without feeling pressured by all biological timelines, right? It promotes autonomy and empowers women to make informed decisions about their reproductive futures. And advocating for the improved access to egg freezing services and fertility preservation coverage can contribute a greater gender equality in healthcare and society as a whole. Like I mentioned, like for me, the reason I do this is because I still want to enjoy my life. And I'm not sure if I want a kid or not. Like, but I'm not young anymore. So I'm already in my mid-30. I need to do something to make sure I have a choice in the future. But also I realized I'm like very privileged to do this procedure in Melbourne, right? The overall cost is a lot. Because I save money from like I work for more than 10 years. I save money. I have the money to do this and I choose to do this. So I don't want to recommend everyone to consider, but like it's good to know what is expressing and what like this can provide you an option. But also be remember, it's not doesn't mean like you can guarantee to have a baby in the future. Also depends on the quality of the eggs, right?
Yeah, and I would also imagine that it also plays into the health of the person, right? Like your own health moving forward, because your body can change between the time you freeze the eggs and between the time when you're ready to have a baby. You know, I have, friends who are uh, thinking about going through this process, but like, what happens if you get fibroids or something else happens and it can complicate things for you? So there's so many factors.
I think like the society really do this a good thing for women because before they cannot allow you to freeze your eggs
Mm.
unless have a medical condition like cancer we mentioned, right? You cannot and you're gonna going under chemotherapy, you cannot just do the fertility, like the fertility process. Then you can do the egg freezing. And also it's covered by the medical insurance. For now, and I don't know how like when it opens to the people who like for women in single, right? I also know it's very interesting when I talked to a doctor in Singapore, he mentioned to me like for men, you still cannot freeze your sperm unless the people is suffering medical condition. Yeah, I think like this is a really good opportunity for women to really thinking about your choices, right?
Yeah, hopefully there will be more places in the future that will be able to offer these services and allow people to do them, regardless of if they have a partner. Um, but yeah, I mean, it's it's great, as you said, for this to be able to give women the agency to make a choice. I think that's the most important thing.
Yeah. I do hope some like one day and China can open this procedure to the single women and to have people have more choices. Even though I think nowadays more and more people, like more and more women are decided to having baby by their own, right? Like not having a partner or like not having a husband, but like it's also a choice they can offer, right? So I hope someday like China can open this. Then people don't need to fly to overseas with the high expense like the cost and with like if you don't know the language, you don't have friends, there's no support systems. So I'm so lucky to have a friend live in Melbourne, so I'm living with them. So everything's just like easy for me, but I hope like the whole process in the future is easy for everyone to consider this and do this in their country.
Mm.
Okay. As we wrap up today's episode, we hope we've shed light on the complexities and benefits of egg freezing. It's a powerful option that offers more control over reproductive choices and can significantly impact one's life planning.
Thank you for joining us on this journey. Remember, the decision to freeze your eggs is deeply personal and should be made with comprehensive information and support. Stay tuned for our next episode where we'll continue to explore topics that empower and inspire. Until then, take care and keep making informed choices for your future. See you next time on Cultural Collision. Bye.
Bye.